Good afternoon, everybody. Welcome to my weekly podcast. Today's topic is examining ethical approaches to research with children and adolescents. Working with infants, children, and youth, it is a vulnerable group to work with, especially when conducting research in the area of sexual abuse. It can be overwhelming and traumatic for the child being interviewed. Since many children have been victims of exploitation during research in the past, which is why it is important to properly communicate with the child and adolescent information that they will understand according to their developmental stage. When conducting a study with infants, children, and adolescents who have been victims of sexual abuse, it becomes a sensitive subject to touch. When preparing for research with children and youth, there are guidelines to follow. First, written and signed consent must be obtained by the parent before beginning research. It is also important to provide the parent with adequate steps on how the research will be conducted. One of the most important guidelines when conducting research is developing appropriate communication with parents on what is going to be asked and how the parents can support the researcher and child by helping communication flow easily. Building a rapport with the parent is as important as building a relationship with the child, as this helps the researcher have adequate information and help the research be more accurate. When disclosing results of research of sexually abused minors, disclosing results can be risky, costly, and may be harmful if inappropriately disclosed. The need to practice precautionary approaches when disclosing results is a must. When releasing results to research communities, there must be good evidence that testing procedures have been validated. For example, in the United States, the Clinical Laboratory Improvement Amendments requires certification of laboratories that perform clinical tests, basically to make sure that reliable, accurate clinical testing is being performed and released. Disclosing findings to research community is important as it facilitates collaboration and decreases duplication of efforts. It helps with feedback and verification, although there is often fear of being scooped or criticized by other research entities. When disclosing research findings, there is an ethical obligation by ensuring confidentiality of the participant, the victims, and others involved in the research. The researcher must also be sure that everything that is being disclosed is properly interpreted. When disclosing to the public, there needs to be recognition that there may be dangers in providing graphic description of sexual violence in children, and it may be sensitive to some, often causing triggers, and in instances, it has been found that graphic sexual violence disclosure is misused by those using pornography. Hopefully this was good information to everybody, and see you next week on the next podcast. Have a good afternoon.